Hi, Dr. David Culler, your New York City chiropractor and director of Synergy Wellness, Chiropractic and Physical Therapy in Manhattan. What is spinal decompression or traction? First, let's discuss the difference between spinal decompression and traction. One last thing. Tell me what you think in comments below. I went to film school before I got my doctorate. I do all the writing, directing, producing, sound, editing, and the cool special effects you see here. Folks, I'm not asking for an Academy Award or an Oscar, just a simple thumbs up if you like my video. And don't forget to subscribe to my channel for the latest, greatest content on YouTube. Thank you, appreciate all of you. Traction is a form of decompression. Both can be done in the lower back or lumbar spine and the neck or cervical spine, and can be done either manually by laying on your back with your knees bent. Check my video, I show you how to do home traction. Or another example could be hanging from a chin-up bar, for example. Traction can also be done mechanically with several types of traction units that are on the market, like the Teeter Hang-Up, Invertrac, Pronex. I'll leave my favorites and their links below. Before you go hanging upside down on one of these gadgets, wait. I would get your chiropractic doctor's approval first. The most common question I get, spinal decompression and traction, are they the same? The key difference between regular traction and spinal decompression therapy is the computer. The program creates variations in the traction pull rather than simply pulling on the spine at a preset rate, angle, and force. The spinal decompression system can adapt to a patient's body, react, and allow the patient to keep the body relaxed. This makes the treatment more effective than what can be achieved with regular traction. Spinal decompression is similar to traction in that you are strapped by the waist and feet or neck region, but it uses a computer to sense when muscle fibers are guarding. It will gradually release and then decompress more, anywhere from 25 to 75%. This pumping action helps nutrient-rich fluids flow to the disc via capillaries on the surface of the disc. Discs are avascular and therefore take longer to heal. This allows for additional healing to occur in the areas of the disc degeneration. At Synergy Wellness, Chiropractic and Physical Therapy in New York City, oftentimes we add cold laser therapy to help speed herniated disc healing even more. Cold laser with spinal decompression together are extremely effective for severe cases, especially people that are considering pain management, injections, or surgery. When used properly together, it's a game changer. If you've been diagnosed with a herniated disc, spinal stenosis, degenerative disc, disc bulge, sciatica, or any other type of pinched spinal nerve, you may be a good candidate for spinal decompression. Please be aware, there are a few types of disc herniations that can flare up with spinal decompression, and even worse with traction. They need to be handled with more care. We are able to get MRI imaging, tolerance test patients, and use cold laser therapy to help with acute patients and reabsorption of the disc, and then begin a spinal decompression program. First type to be careful with is a disc fissure or crack in the outer fibrous layer of the disc. And the second is an inferior disc extrusion or sequestration of the disc, where the inside of the disc leaks out inferiorly, oftentimes causing a chemical irritation in the form of inflammatory cytokines. Some contraindications for spinal decompression therapy are pregnant women, patients with broken vertebra, patients who have had spinal fusion, patients who have had an artificial disc or other implants in their spine, patients with failed back surgery, anyone who has had multiple surgeries without recovery or pain improvement. In all but one of those cases I just mentioned above, coxflexion distraction would be a better option. It's a gentle approach that's perfect for post-surgical cases. Synergy Wellness has 2 spinal decompression tables and 2 coxflexion distraction tables. Take your pick. We've got the table and the doctor for you. The second most common question I get, does it hurt? Spinal decompression should not be a painful intervention. Many patients find it to be pleasant, and they find it akin to getting a therapeutic massage or a good stretch. The release of pressure from compressed joints is usually a great relief. Synergy Wellness, chiropractic and physical therapy will ensure that you're completely safe, comfortable, and supported during the process. Depending on the nature of your spinal problem, you may experience some light discomfort during some portions of the procedure, but this is unlikely to be significant. I hope this video is helpful, and if you have any questions about the difference between a disc herniation and disc bulge, check out my other videos, or the video I did explaining what is spinal stenosis. You can even check out our 3D video I made showing you how a disc degenerates over time. If you want to see any specific videos, just comment below. Thank you, appreciate all of you. See you soon.